Kristin Mallon is with us here today. How are you doing?
Great, thanks for having me.
Now, your podcast is called True Birth, which is basically just about the whole pregnancy and birthing process, right?
That's right.
So what kind of topics do you cover in it?
So the purpose of True Birth podcast was really Dr. Abdellic and I'm a certified nurse midwife, and he's a high-risk perinatologist. And we have a lot of patients that kind of get information from everywhere. There's just like this plethora of really interesting information out there on the internet and from their friends and peers, and I think blogs and different places that we wanted to kind of have it come from a place of what the experts have to say.
Yeah. And do you feel like pregnant women are sometimes scared by people who have given birth before because they always tell them about how bad it was?
Yeah, for sure. So I think that there's this kind of, if you go on a trip somewhere, we're from the United States. So if you go on a trip to Florida and you have a great time and you come back and someone's like, how was your trip? You're like, my trip was great. I sat on a beach and I read a book. Yeah. But if you go to Florida and there's a hurricane and the flight was delayed and your boat sails away and you have a car crash, it's like a horrific story that you kind of tell every single person and ends up being a 30-minute story rather than like a 2-minute, I had a great trip.
Yeah, because I've heard some women who, people they don't even know, have came up to them in the shop and seen that they're pregnant and proceed to tell them how bad their labour was.
Oh, yeah. And it's kind of almost like a cathartic moment that I think women who have bad birth experiences are always trying to kind of warn everyone else about this horrific impending doom that's looming over their head, which is not true. And the whole point of the True Birth podcast, the whole reason why we started it is we really wanted to give women this opportunity to have information from experts between the two of us. We have over 12,000 births between the two of us, and give women true, accurate information, and also information so that they can have better births and better birth experiences.
Yeah, and I take it there is still some element of truth in the fact that giving birth is quite painful.
Right, it doesn't have to be. There are lots of ways to mitigate the pain, so it doesn't always have to be. But yes, I think a lot of the fear comes from the underlying pain that is associated with birth, yes.
Yeah, and what do you think of this home birthing thing that people do where they give birth in their house with no kind of proper medical help? Is that a good thing?
Well, there's two different things that you bring up there. There's something called home birth, which I think is safe for the right candidates, and women can be screened appropriately by a trained medical professional, whether or not they're a good candidate for a home birth. And I think that sometimes if a professional says you're not a good candidate, they have to kind of give that up and let it go. And then there's something else that you bring up, which is called free birthing, which is when a woman will give birth without any trained medical professional. And I do not support free birthing, but I think home birth is a good option for women who are screened appropriately.
Yeah, and what are the sort of main benefits of that? Is it just perhaps you're more comfortable in your own home?
So I think the benefits of that is something that's a little bit more unique to each woman. And it's kind of something more like, what's the benefit of running a marathon, or what's the benefit of climbing Mount Everest? It's something that it's a feat that certain women have within them the desire to accomplish, because nowadays labor suites and birthing rooms are so comfortable and accommodating that they really, in the last even 3 years, 5 years, just really changed dramatically to kind of be more home-like and be more comfortable. That I think home birth is just more kind of a style, and it's more kind of a something that women kind of want to do as like something for themselves and something for their family.
Yeah. And what are the strangest myths that you've ever heard about pregnancy and giving birth?
So I think one of the biggest ones that I would love to dispel is women always think there's some magical crystal ball, and especially me, because I'm a midwife, they think that we're going to be able to tell them when the labor is going to begin. And is all the information that we know and all of the amazing technology that we have, it's still one of the amazing mysteries left in the universe. Like we've gone to the moon and we're going to Mars and we've gone to the depths of the ocean, but we can't tell women when labor will start. We just preterm labor sneaks up on us, and we don't know. Some women go to 42 weeks. They're going way past their due date, the anticipated date that we thought that they were gonna go into labor. And that, I think, is one of the things that I just want to tell women. There's no way, and they read on the internet all the time, well, if I have this nesting instinct and I have diarrhea and I have this, my baby drops, and if I have a sense to clean and all these different types of things, there's really just no way to know.
Yeah, it's just whenever the baby's ready. That's what people say, but I don't know if that's the proper scientific reason, but I guess basically that is, right?
That reason is as good as any, because we don't really know when labor will start.
Yeah. And being a midwife and having this woman in a lot of pain, do you have to have quite thick skin to do that job? Because they might just be angry at you.
That is a really great question and a really astute insight, because I definitely think the answer is yes. And I've been doing this for 15 years. And I think when I first started, I had much thinner skin and it affected me much more deeply. And now I kind of don't let the sweat roll off my back.
Yeah.
I kind of go with the flow a little bit more easily, and kind of, women will look at me and they'll be like, this hurts. And I'll be like, it's supposed to. I'm like, yeah, that's normal.
Yeah. And for the podcast, do you have regular guests on it?
So the podcast is in its infancy, and we are starting right now with just kind of getting all the topics between Dr. Yaakov Abdelik and myself out. Yeah. We feel like a lot that we have to say, but eventually we'll be bringing in guests.
Yeah. And what kind of people would you be looking for? Is it experts or perhaps women with experiences that have given birth?
So we feel there's a lot of birth podcasts that cover birth stories. So we don't know that we need to contribute more to that space. We really want to kind of give the stories from our perspective, from the experts' perspective, and kind of from a, this is what we collectively see, because then women don't get tied down to this happened in this one person's birth. Like that's going to happen to me. Yeah.
And because you're experts, do you take it down a notch and explain it in simple terms to people who perhaps don't understand all the technical terms of medicalness?
Yeah, we try to make it more common English talk, where we explain the big names and then we kind of break it down so it's a little bit simpler to understand.
Yeah. So how did you first start to get interested in this field of work then?
A long time ago, I actually thought I wanted to go into psychology. And then I kind of was going through that process in my undergraduate. I went to UC Berkeley. And as I was going through the process of gaining the degree, I was working with adults, and I was like, wow, these, there's been so many things that have led to all of this kind of, what leads someone to a mental health issue in adulthood. Yeah. And I was like, how far back do I have to go? And then I was like, do I want to work with adolescents? Nope. I need to go back further. Do I want to work with kids? Nope. I want to go back further. Do I want to work with, young kids? And then I was like, actually, what I think really helps people to kind of get them set off on the best foot, and I think kind of ties into midwifery in general, is like this concept of prevention. Yeah. So then I'm like, if I can help a woman have a great empowering birth, then I'm setting her off for the right mental health going forward, and then hopefully for her family going forward.
Yeah, absolutely. It's good to get it right at the start.
Exactly. So I've always been a prevention kind of person, I think, rather than a treatment, which is why I think midwifery struck with me more than obstetrics and OB/GYN.
Yeah, and it's interesting you mentioned about the mother herself having a good birth. Do you feel like the birth process itself has an impact on perhaps postnatal depression?
Oh, absolutely. So I think what I really think that the podcast is helping to accomplish also is to set women's expectations proper, because that, I think, is really the accumulation of what can ultimately contribute. I mean, there's multiple different things that I think lead to postpartum depression and postpartum anxiety. And if there's 10 things that cause it and we can prevent 3 of the 10 things, then we're well on our way to the prevention of postpartum depression and anxiety. And I think having a birth experience that matches the expectations is a big part of that.
Yeah, I suppose so, because a lot of it might be caused by disappointment. Oh, is that it?
Yeah, absolutely. So birth disappointment is, you hit the nail like right on the head. Yeah. It's a huge thing. And I think, I feel like as providers, it's our job to educate. And that's what the podcast is all about, is educating and empowering women to kind of what to expect. Certain things that, like, sometimes when a woman having her first baby, it'll take her 3 or 4 hours to push the baby out.
Yeah.
And women in their mind sometimes think that process is like, they see on Instagram or they see on like YouTube videos, like a woman pushing a baby out in 5 minutes. And so they don't have, when they get to that moment and it's taking 3 hours, they are very disappointed, versus the expectation of like, hey, this could take 2 or 3 hours. And then when it takes an hour, they're like, hey, that was great.
Yeah, because I guess in these videos, you're only seeing the last few minutes of it.
Exactly. And everything's edited down, edited for TV and then edited for Instagram and edited for the 30-second promo.
Yeah, it'd be very boring to watch it all for hours and hours, unless you were really some sadist or something.
Right. I'm sure those videos are out there somewhere too, but they don't have enough views where people are watching them.
Yeah. And how has COVID affected the birthing experience?
So in the beginning, I mean, it's different in the UK than I think over here in the States. We got hit really hard in the beginning of March 2020, and that really affected the birth. They limited the people in the room, and they limited the guests and the visitors afterwards. But now we're really back to normal, and women, there's no difference now at all. They're tested when they first come in, and they're expected to wear masks until those tests are back. But for the most part, a lot of it is lifted.
Yeah, I think we're probably about the same here. You'd probably have to wear masks and be tested. Although I think home visits, which we kind of normally do in the days and weeks after the baby's born, have been obstructed in some way, but I'm not sure how.
Right. I think that's another difference between Europe and the US in general, is there's a lot more home visits. And in the United States, we don't really have medical professionals doing our home visits. We have these women that do home visits that don't really have as much medical training. They're called doulas, or they're called labor assistants. They do a lot of the home visits, or lactation assistants or lactation consultants. They do a lot of the home visits postpartum.
And of course, in America, it costs a lot of money to actually give birth in a hospital.
Yeah.
Well, where are we able to check out the podcast if we want to have a listen to it?
So the podcast is available on anywhere you listen to podcasts: Apple, Spotify, Google, Overcast, Castro. And we do have a website, which is truebirthpodcast.com.
Great. Well, thank you very much for joining us on the show today. It's been a very interesting chat.
Yeah, thanks so much for having me. It was wonderful to talk to you.